taking care of Joey today. Hand hygiene. How are you doing?
I'm good. How are you?
I'm good. How are you doing, Joey? You're good? All right. And you're Joey's mom, correct?
Yes.
Okay, awesome. All right, Joey, I brought you these toys, some blocks and some toy cars to play with while I talk to your mom a little bit. Okay, so first I just want to have a little bit of a conversation about his growth and development, make sure that everything is looking good. So typically around this age, we like to see that they can pick a ball, run around, start going up, walking up the stairs with some assistance.
Yeah, he's hitting all of those.
Okay, awesome. And then for a couple of more like finer movements, we like to see eating with a spoon, being able to point to things, stacking a couple of blocks, which I can see he can do. So
He loves to try and feed himself all the time.
great, that's good to hear. And then as far as language goes, we like to see that he can start saying like 2 words at a time. Being able to like point to his body parts also helps understand.
Yeah.
Us see that he's understanding things.
Yeah, he can do that.
Oh, perfect. And then also like nodding yes and no to respond. Okay. And then for toys, what does he like to play with them?
He likes to play with the blocks. He likes those big, like chunky Legos too. So.
Okay, great. Those are all toys that we expect him to like at his age. And then for play, just something that a lot of parents are concerned about is they don't quite like to play with other people. Have you noticed that?
Yeah, him and his cousins will go off to the playroom, but they don't ever play with each other.
So we call that parallel play. So they're in the same room playing separately, but kind of together.
Yeah.
In the same room.
Okay.
That's totally expected at
Okay.
his age. So yeah, great. It sounds like he's doing great with his growth and development. So I'm going to start an assessment. Throughout this whole time, I have been looking at Joey, just looking at his overall appearance, color, respiratory effort, counting respirations for around a minute, and his respirations were 20, which is, or 25, which was within a normal range for his age of 2. He's not having any retractions, any nasal flaring, anything that's showing respiratory difficulty, and then his color looks as we would expect. So, alrighty, Joey. I'm gonna take a look at you and make sure that everything's looking good, okay? Alrighty, is it okay if I start by just feeling your arms a little bit, seeing how warm or cold they are? Alright. And they are warm, and then I'm gonna put my fingers like on the inside of your arm to test and see if your arms are getting blood, okay? And for a 2-year-old, that's like the borderline where we would be testing for brachial pulse. That's going to be a little bit easier than a radial pulse. His pulses are present. All right. Now I have this thing called a stethoscope. So what we do, I'll show you on me first. We put it on our chest, and then I can hear your heart and lungs. Okay? Can I do that on you? All right. I'm going to have to pull down your gown, though. Is that okay? All right.
If it was 38, it would be 100 degrees.
And then one thing you'll notice a lot now is if he sort of cries or anything, it'll be
Next,
kind of
Ralph,
swollen.
I'm going to check your
But since he's 2 years old, he
check your blood pressure first.
maybe we find
And then I would listen to a pulse for 1 minute.
And Ralph, it's gonna squeeze.
For video purposes, I'm not actually going to listen for a minute, but it was 120, which is within the normal range for a 2-year-old who is awake. Alrighty, and then Mom, I'm going to have you come help us. I'm going to have Mom give you a big hug, Joey, so you can sit up and I can listen to your back, okay?
This is it's called a stethoscope. And see, kind of looks weird. Feel it more.
Alrighty, and you can lay on back now. Alrighty, and lung sounds both on the front and back were clear. I'm not hearing any wheezes or anything like that, so that's awesome, Joey. Now, is it okay if I take a look at your legs? Yeah. Okay. So once again, like I did with his arms, I'm looking at color, I'm looking for any edema, I'm gonna feel them, they're warm, and then I'm gonna check for pulses. All right. You're doing so good, Joey. Alrighty. Now, can you say ah? Alright. And mucous membranes are moist, so that is great. And then I have this flashlight that I'm gonna shine in your eyes, okay? So you just have to look straight, okay? Perfect. Oh, your eyes are so beautiful, Joey. Alrighty. And then throughout this process, I have just been looking at how he's reacting to me, making sure he's opening his eyes spontaneously, following commands, any of that, and everything is good. So his GCS would be 15. So that is great. Alrighty, Joey, now can I look at your belly? Yeah? Alright, I'm gonna lay you back. And then I'm gonna do the same thing like I did up here. I'm gonna use my stethoscope and listen. Okay? So first I would just look, check for color, any distension, anything like that. Make sure it's even on both sides. And then I'm gonna take a listen.
Okay, Rob, now I'm going to just check the overall body and check to make sure he's looking all good.
Alrighty, and bowel sounds are active in all 4 quadrants. And is it okay, Joey, if I just feel your belly a little bit? It'll just be a little bit pressed like that. Okay. Tell me if it hurts anywhere. Alrighty. And then I'm gonna just give a little squeeze on your belly for skin turgor. Alrighty, and everything looks good. I'm gonna sit you back up now, okay? And then Mom, he's not potty trained, correct?
No, not yet.
Okay. And we don't expect him to be. Usually we say potty training around 3 years old. So he's perfectly on schedule. About how many wet diapers per day would you say he has?
Probably about 4, give or take, you know.
Okay. That's exactly what we would want. We want to see at least 3 or more. So that's perfect. That just helps us keep track of his hydration and stuff like that. So, alrighty, now Joey, I'm gonna squeeze your finger a little bit. I'm gonna see how it turns white and then it goes back to a normal color. I'm gonna see how yours does. Awesome. I'm gonna do the other side. And it is less than 3 seconds. And then I'm gonna do it on your feet too. Alrighty. Awesome. And then I would also assess for or make note of any tears because that has to do with hydration status. And then since Joey is 2 years old, his anterior fontanelle should have already closed, so we don't need to be looking at that. And then Joey, this is gonna be a fun little test. I'm gonna have you stand up. You're gonna walk all the way over there so that I can weigh you and see how big and strong you are, okay? Alright. So as he's doing this, I would look at his gait, just see what he kind of looks like. He has that kind of like a little bit of a waddle, wider stance. That is completely normal with toddlers. He also has a little bit of that pot belly and lordosis, which is also a very normal finding in a 2-year-old. So it's all expected. Alrighty, Joey. So I'm gonna have you step up onto here.
I guess for now.
Awesome. And he weighs 11.9 kilograms, which is around average for his age, so we have no worries there. Then we can come on back over here in the bed. Alrighty. And can you point to your nose for me?
Plug it in. And he would of course show
job.
full socks above
And can you blow your mom a
Ralph, you're
kiss?
sitting at 96.
Good job, Joey. You're so sweet. Alrighty. So now,
Okay.
I have this little clip. I would turn on my machine, but ours doesn't turn on. I have this little clippy. It's gonna just go on your finger like this. Just go right around it. It doesn't hurt. Do you want it on this hand or this hand? This one? Okay. And this is just gonna tell me how good your heart and lungs are. See your oxygen. All right, and our O2 is at 95, which we just want it to be above 92 for his age. So that is great. Alrighty. And Mom, when was his last bowel movement?
I changed him just before we came to the office.
Oh, perfect. Alrighty. Alright. And then I don't have to do blood pressure on him because he is under 3. So, unless there were some sort of medical thing indicating that he were to need it. And now the last thing I'm gonna do, our leads that were in lab, we don't really have what we need, so I'm not gonna do those. I'm just gonna show you where I would put the leads on. So I'm going to bring your gown down, and then I have these super fun stickers that are gonna go on you, okay? So I'm gonna put one right here, one right here, one right here, one right here, and then one right here. So that is our telemetry. And these stickers are gonna make you look like a superhero, okay? Alrighty, and then I have one last thing for you, okay? I'm gonna see how hot or cold you are. So, I'm gonna bring this over your forehead and down to by your ear, okay? Awesome, and the temperature is 37.3, so that is within the normal range. If it were above 38, we would be concerned, so, because that's considered a fever. Alrighty, Joey, I'm gonna leave you with these toys, but if you need any more, let me know, and I'll be back to check on you in a little bit, okay? And I may even bring you some stickers when I come back. Mom, do you have any questions for me?
Nope, I don't think so.
Alright, awesome. And I'll be back in a little bit.
Okay.